Hello there. Happy Friday, everyone. My name is Julie Hirschberg. I'm coming to you live from Re+active Therapy here in our West LA office, as I often do on Fridays. So happy to have you join me today on this Friday, the day after we just had our 3PD course. So our 3PD course was live last night, and actually the recorded version of the course should be up today. I know I had several people reach out to me and say, "Hey, when can I get it?" It's coming. And often the day after we host a course is when I like to share some of the little pearls, some of the things that we found really helpful in the course, some of the things that we're learning and growing with. So I'm really excited. I feel like obsessed with 3PD right now. I've read so much literature about it in the last couple of weeks, but especially the last week. Actually, reading about 3PD was like my distraction from all of the news that was going on right now, and the election. So I know this time in the pandemic, in all of the politics that are happening, that it has really been a time of a lot of increased stress for people and more challenges. I know it has for me, and I have found myself using a lot of the techniques that I teach other people to use, like people with 3PD. And this was one of the key take-home points that I want to talk about today, is how important some of these pieces are, and if they're missing, how you can really set someone back. So what I want to hit on today is some of the highlights from our course, particularly some of the little pieces that we talked about, like the relationship between 3PD and concussion. What does fMRI tell us about the functional connectivity issues in 3PD? And how can education help improve the disorder? And how that's kind of the cornerstone of the treatment. So let's start first with the concussion piece. So we talked about this, and in particular, Brittany Charlet, one of our newest therapists at Re+active, she presented this course with me, which was awesome. She did awesome. I'm so excited to do more courses with her. But her background is as a vestibular therapist and in concussion. And so this is something that she has certainly seen quite a bit. And not all dizziness and concussion is 3PD. So that was something that she really pointed out. Something that is really important is that 70% of people with 3PD, their cases are triggered by a structural acute event. So of those people, 10 to 15% of them, it's actually concussion that was the initial event. And I know I've seen this, Brittany Charlie has seen it, many people shared last night that they've seen this as well. Migraines, another really common one. About 15 to 20% of people are triggered by a migraine. Peripheral or central vestibular disorders are actually the most common. And this we talked a lot about last night, is how tricky it can be when somebody has that as the initial onset and maybe it hasn't resolved. So you actually need to treat the vestibular dysfunction and the 3PD. And sometimes the intensity of the treatment may have to be modulated because of the visual sensitivity or the motion sensitivity. So when 30% of those 3PD cases are actually caused by that initial acute vestibular dysfunction, there's a lot of neurologic testing that needs to go on to help distinguish that. And then finally, 7% of the cases of 3PD are triggered by an autonomic dysfunction. And I think that's really important. The autonomic nervous system is something that more and more is just cropping up as an important piece of what we need to test and treat. So this was, when we think about concussion, dizziness is a common symptom, especially in the post-concussion symptoms. So if somebody has experienced a concussion and head trauma, they may have dizziness. And what Brittany Charlie talked about is that need to fit the diagnostic criteria of 3PD to have 3PD and post-concussion syndrome. So I thought that was a really good point, is that not all dizziness post-concussion is 3PD. So making sure it fits those diagnostic criteria. Now, I want to talk a little bit about the autonomic piece, because this was so good. And a lot of people commented on it in the course of a missing piece for them. So one of the big pieces of treatment are, and one of the first steps is ensuring that the person can find a place of grounding. So that when they push into dizziness, they can always come back and have some control and autonomy to do so. So this is something that then becomes the very first step of what we might do. And finding really appropriate grounding techniques for a person is a lot of discovery. Not everything works the same for people. So there's a sitting grounding technique we've actually done a cheat sheet with. I'll put a link in for you, so if you're not familiar with these techniques. But that's usually where I'll start. So it's a simple technique of sitting, and really it's an awareness practice, a mindfulness practice of awareness of the pressure and the support through your feet, through your hips, maybe through your hands as well. And it's attending to that and attending to the support, the proprioceptive, the sensory feedback that you're getting. That's part of the intervention for 3PD, and starting there so that then when you walk in the hallway and you're turning heads or you're doing some other optokinetic stimulation, you can bring the symptoms down yourself through a grounding technique. So autonomic is a big piece. Okay, so that was a couple little nuggets there, talking about concussion, talking about the autonomic piece. The pathophysiology, this part always interests me the most. And there has been some really great work coming out in fMRI in 3PD. And so some of the things to really think about is, in many ways, what happens in 3PD is a normal process that would happen for any of us, and does happen for us if we have an acute vestibular dysfunction, or even if you think about, like, if you had to walk on a really icy surface and you're not used to it, which for us in Southern California is not a very common thing. So you might use your vision a little more and weight that over your sensory cues because you're walking on ice. You might stiffen up a little bit and take short strides, right? Like when you're walking on ice. You might reach out for things for extra support. Think of, I don't know if you've ever like ice skated or learned to ice skate. I can think of my own kids, like they're holding onto the sides, they're taking these little bitty steps. And then you get a lot of vigilance and acute attention about the motion of your own body and the environment. You're taking that all in. It's a normal process. It just goes awry and becomes chronically entrenched in 3PD. And what the fMRI studies show is that there's altered activity in networks for spatial orientation. There's reduced connectivity from places like the left hippocampus to other brain regions. This is they're really cool images from some of these studies, but increased connectivity in the visual area. So that makes sense. You're over relying on visual information. Also, some studies have found decreased vestibular cortex activity. So not using vestibular inputs as well. So I find this so fascinating because it tells us exactly where we should go with treatment, because we need to basically decrease that visual activity and increase some of the spatial orientation, sensory, and vestibular areas. So this is why I love the pathophysiology, and studying it directs us right to treatment. And the third nugget that I really wanted to share is education is the first piece. And Tammy says, can you post some of the studies? Yes, absolutely, because there was a bunch of studies that were free full text, by the way. So I will, I'll post these in here because they're so fascinating and just such great resources. And a lot of them have come out just in the last 3 years. So a mainstay of intervention is education. One of the first pieces, and this becomes very important in our own differential diagnosis and neurologic testing, is to show that the triggering event has resolved. So if the triggering event was a migraine, if it was a vestibulopathy, if it was orthostatic hypotension, that those things have resolved. Sometimes you actually have to work with the person to help those resolve. So that's the very first step. One of the things I really love to do, and we include this in our paperwork, is identify what the person has going for them so well. What are their assets? What are their strengths? This is something that Janine Holmberg really highlights in her work. And when I went to her CSM talk at the beginning of this year, I changed our paperwork when we write up their goals with our patients and give it to them at the end of their session. We outline their assets and what do they have going for them. And often they have a lot going for them. They have some good balance responses. They have good strength. They have a good activity level, and really identifying those so that they can use them to their advantage in their healing. And then the third piece, which is so important, is explaining the pacing and graded exposure that is needed to move into provocative symptoms and come back, and move in and come back. And with 3PD, it's not very intense. It's baby steps so that plasticity that's gone awry can go in the positive direction. So that's where we start with a lot of our sessions, is in the education and in this like grounding and autonomic piece. So I'll put a couple of links. So let's see, I said the grounding tip sheet that we have that takes you through a sitting grounding practice. We also use our river runneth over analogy a lot, so I'll place a link in there. You can grab our course now, so it's recorded. I'll put a link in there. And then I will also link to some of these great articles that we referred to in the 3PD course. Bottom line is there's a lot of hope for full recovery, restoration of normal function for people with 3PD. And there's a lot of ways too. That pathway is very person specific, and it takes some very careful dosing to get there. But we had a great time last night. I really appreciate people bringing their questions and cases and reflecting on it together. I learn a lot from everybody else every week. Honestly, it's so great. So I thank you for joining me today, this Friday. I will see you again next week, and have a great weekend.